Hello, I'm Solomay Tibabu, the host of the Going Digital Behavioral Health Tech Conference. I'm so excited to have Ken Fasola and Dr. Caroline Carney here with us from Magellan. Welcome, both of you.
Thank you, Solomay. It's great to be here.
Great to be here, Solomay.
Thanks a lot. Ken, how about we get started? If you could just tell our audience a little bit about Magellan Health and the work you do.
Yeah, first of all, thank you again for just this incredible opportunity. It's really an impressive group of leaders at a really important time in our industry. And I give you great credit for creating the platform for us to be able to talk about the amazing new technologies and important clinical breakthroughs. So I've had the privilege of leading Magellan for approaching 2 years now. It's hard to believe that time really has come by that fast. And I picked an interesting time in history, given all that we've had to deal with. And I think it puts a bright light on some of the important work we're all doing together around the impact that the pandemic, the challenges facing our communities are having on the mental and physical well-being of so many around the globe, really. And so Magellan is in the middle of an amazing transformation. We've sought to reimagine, reshape, and really invest in taking years of deep, rich, sovereign skills in and around behavioral health, specialty care management, and now pharmacy, and bringing it forward in ways that are really exciting. When I got here, Magellan was really largely in three businesses. We had a managed Medicaid business, we had our pharmacy business, and then we had our behavioral and specialty health business. First thing we did was rationalize our strategy. We divested our managed Medicaid business to move and focus fully on payer services in both behavioral and specialty businesses, as well as our pharmacy business. That allowed us to generate a significant amount of additional capital, which we're looking to reinvest in new technologies. Magellan's a company that had deep, rich experience in managing the most complex and severe cases, not just in behavioral health, but broadly, particularly in our specialty drug business. And so the advent of being able to take advantage of this amazing new wave of digital and clinical capabilities was really important to us. And we're trying to bring that together in a seamless ecosystem that focuses on the whole person. This move to value-based care has been really important. And what we have tried to do is take a business that was largely siloed previously and bring it together in a more integrated and collaborative approach. And that's really leading the way we're thinking about working with clinicians. The goal here is to improve the member experience, give them, not just broad access, but availability when and where they need it. And as importantly, to do the same for the clinicians who serve them, to create programs that allow them to work with top of their license, remove abrasion and friction that's often historically accompanied a more utilization-oriented approach. And it's serving us really well. Caroline will talk more about that. But in summary, we've got a behavioral and specialty business. We've got a network of over 118,000 clinicians. We have a PBM. We're the largest pharmacy benefit administrator in the country, serving 27 states in the District of Columbia for Medicaid pharmacy administration. And we have a specialty pharmacy business, which Caroline can also elaborate on, that's making amazing clinical breakthroughs.
Excellent. Thanks so much for that background. Dr. Carney, with Magellan's deep behavioral health experience, what can you share about learnings around behavioral health and physical health, especially in light of the pandemic?
I first want to thank you for hosting this conference again, and the energy behind all of our colleagues across the country working in consort to the right ends it's really never been more exciting. As a psychiatrist and an internist, I am thrilled about the attention now being paid to mental illness and to both mental and physical illness occurring in the same person. I think we really have to step back a little bit to understand what's happened in the last year, 2020, with the pandemic, because coming into the pandemic, we were already facing some mental health crises in the country. The opioid use epidemic was at its height and starting to come down in a positive direction. But with conditions like anxiety, bipolar disorder, and depressive disorders, those conditions accounted for for some of the top reasons for disability in the country. And we were still creeping toward that nadir of the availability of behavioral health professionals in the country. And then COVID hit. And it's like a perfect storm happened with not only the kinds of issues being brought up with the disease itself and the fear itself and the grief coming from individuals who we know and love. I think all of us are probably only 1 or 2 degrees separated from having lost someone to COVID. Job loss occurred, market change in lifestyle occurred, all of these things creating kind of the perfect storm for mental illness, unfortunately, to really, really flourish. We saw some startling statistics in the last year. 2 in 5 Americans are struggling with behavioral health issues, particularly symptoms of depression and anxiety disorders. And as a mom of teenagers and young adults, the figures for that age group really, really are concerning. 25% of kids, I'll call them kids, aged 18 to 24 years old, have considered suicide in the month prior to the last wave of the CDC survey. 1 in 4. It's really alarming. And those numbers translated into what was being seen on the ground in terms of emergency department use, which increased by 26% for individuals coming in with suicide attempts and 36% for overdose. So it's just, again, painting some really, really sobering figures about this. Other surveys, household surveys, have shown even higher levels of distress and of primarily, again, depression and anxiety in individuals like young adults and those taking care of dependents who now during COVID couldn't get a break, couldn't step out of the house or get individuals perhaps into respite services. So a big toll. And I would be remiss if I didn't mention the first responders, the doctors, the nurses, the paraprofessionals, the EMTs, everyone working on the front lines. And what they have seen and experienced is now coming out in individuals wanting to leave their jobs, which will ultimately result in a workforce that has become numb or a skinny down workforce from where we are today.
You know, Solome, I'm sorry, Dr.
No,
Carney, but Caroline reminded me, you know, we oftentimes, as a public service, will make a toll-free hotline available to folks in need. And at Dr. Carney's urging, months ago, we put a toll-free hotline available for clinicians on the front end of the pandemic. We still get hundreds of calls a week. Average talk time is over 20 minutes.
And Ken, that was seen by SAMHSA also. So I came across a figure that SAMHSA's national hotline, disaster services hotline, saw something like an 850% increase in calls at its peak. And it's still high. It's still well above where it was month over month, 2020 to 2019, and even still into 2021 compared to early 2020. So we know that people out there are distressed. And I want to have one more doom and gloom comment, because that's going to set up what we have as a company have really solutioned for to address some of these really important needs. We have to talk about access and availability of services. HRSA has studied this carefully and have looked at coming into the year 2025, we will be approximately 250,000 health providers short in behavioral health fields. This is psychiatrists, psychologists, therapists, you name it. The kinds of services that we need people to have won't be available because people are aging out of the field, not coming into the field. Whatever it might be, we'll be heading toward that nadir. So we have to figure out how to get services to individuals who could be treated in a digital format, who could be treated in a primary care or medical care setting, and who need to truly have behavioral health services. So those are the kinds of things that we'll talk about. And I'm really excited to share what our strategies are in these areas.
Yes, that's so leads us to where do we go from here? Um, Ken, we've seen the explosion in the marketplace for digital solutions. I'd love to hear more about what you think trends are around this growth and what Magellan's doing with it.
Yeah, I think one obvious proof point again is, look at the number of individuals and organizations represented in this conference. It's just extraordinary. We work with a number of the organizations that will be profiled across the many conversations you're having, and it's been exciting for us. I mean, really, we could probably meet with a point solution a day, and when you think about it, and which is challenging. When you think we provide payer support, we work with we work with states, federal and local governments, and we have an enviable list of Fortune 50 customers. So we see the business from a variety of different perspectives. The challenges we're facing to support the growing demand in Medicaid is very different. When you think about it, to the challenges we face serving aging Americans. Oftentimes, what's the second or third diagnosis in Medicaid should be the primary diagnosis, and yet primary care doctors are ill-equipped real time to make the most appropriate determination of the best path forward. And so, by being able to leverage data and real-time technology and tools, again, some of which are going to be profiled in your conference, have really created exciting opportunities for us to think broadly across the continuum of care. Again, to Caroline's point, we have amazing, deep, rich experience in serving the most challenging, most complex cases. But we also recognize that we can leverage that insight to support new technologies that are part of our digital front door as people move back and forth across that continuum. They don't just move in one direction. And I think that's really important. And then you take aging Americans, where it's often the loss of functions of daily living, the loss of a spouse, the need to move out of a home, that creates depression and then accelerates the deterioration in their physical health. And look, all of us are going to, when you think about caregiving, right? All of us are either going to be a caregiver or we'll get the benefit of those who will provide care to us. And we talk about virtual care. I'm a virtual caregiver, and my mother-in-law lives a mile from here. Because of the pandemic, we can't get in the facility. So when you think about technology and the ability, not just to support the clinicians in their journey real time, but also, those of us who play an important role in their care, to be able to have that access is also incredibly important. And so, and then lastly, I would say that our last 50 RFPs included questions about diversity, equity, and inclusion, and the important challenges facing our communities. And you lay that on top of what we're dealing with the pandemic and this important challenge that businesses have to bring their employees back to work. And think about, it's easy to say, hey, at Magellan, we've maintained an incredible amount of business continuity and we've been able to keep our employees productive. But that doesn't mean that they don't have challenges with their children, with their parents, with a spouse who may have, or a partner who may have been furloughed or lost their work. So you think about the pressures that pile on. We're not going to flip a switch and bring everybody back. So we're going to have to be thoughtful. And I think the advent of amazing new tools to help us across all of those challenges is really important. And the work we're doing is sifting through these, but with a focus towards an integrated, collaborative approach. It's not about just plugging one thing in. We want a seamless experience for the member and the clinician who serves them. And that underpins the great work that Caroline and her team are doing to evaluate which tools we add, when we add them, and how we make them available. Caroline?
I echo what Ken is saying, and I really want to stress that we as a company are not looking at the next shiniest penny, because there are a lot of those shiny pennies out there in terms of digital tools. What we have taken a great deal of diligence to do is to find the right company and where it fits into the ecosystem of care. And the tool that is available for an individual who has mild to moderate symptoms may not be the same thing that we need to deploy to providers or members who have serious mental illness. And in fact, maybe those tools won't work at all. So we have to be mindful of keeping the same kind of human contact services available, not only virtually, but also still in any face-to-face modalities, or as we like to say, feet on the street, in terms of getting to the individual who needs help. I want to go back to that term of ecosystem. The digital tools are often thought of as point solutions. A point solution is meaningless if all you do is hand off an app to someone and say, here, go get better. And so we are partnering with companies where that simply isn't the case, where we can integrate what we're learning from the use of the digital technology into our own platforms so that our care managers are better armed with the information they need to touch the patient or the member in the right way. So I want to talk a little bit more about our move into fully being an evidence-based organization. We partnered with a company called Arene to do advanced analytics, and the way that they slice and dice all sorts of data really kind of continues to blow me away. They can take everything from claims and auth data, which are traditionally used, to lab data, genetic data, remote monitoring data, data coming in from health information exchange, health risk assessment data, social determinants data, you name it. They ingest everything, and through a continual artificial intelligence and machine learning process, everything just gets updated kind of minute by minute. So as new data come in, the algorithms update and tell us who the individuals are with the greatest risk. And that kind of information has really informed the programs that we've made. One of the strengths about Magellan is we sit across all these different areas. We have a PBM, and we have learned all sorts of things from being able to apply those same kind of analytics, pulling together the PBM data into the behavioral health data, and are finding things like 1/4 of individuals with schizophrenia in large data sets, very large, hundreds of thousands of lives. 1/4 of individuals with schizophrenia are not being treated currently with an antipsychotic, which is evidence-based care for that population. So that tells me I need to figure out the tactics to ensure, with the provider, with the member's supports, what it is that's preventing that individual from getting evidence-based care, and how do we as a company support that individual in getting that evidence-based care. Data is no good if it's just data. It has to be actionable. So taking that kind of thought process is, what am I going to do with this data point to make a change for the better in someone's life? We kind of historically also, as just as a field in behavioral health, focused on what happens in that hour session or that 15-minute medication management session. And instead of doing that, Magellan has moved to wanting to better understand what happens between those sessions. We've partnered with NeuroFlow for a variety of reasons. NeuroFlow came into being as a company that really had a mission to ensure that no individual fell through the cracks. And Chris Malero, the CEO, has a very heart-touching story about why he founded this company. In order to ensure that no patient falls through the cracks, you have to be able to reach and connect with your individual. And I'm sorry, I'm still a practicing physician, so often I say patient when I should say member. So please excuse me for that. By using NeuroFlow's app and their technology, we can support primary care providers by getting that tool into the primary care office, embedding a dashboard into the EMR where all of the information coming off the app on the phone is continually fed into the dashboard. So as an individual is completing evidence-based assessments, there are 26 different assessments in this tool. That information is feeding the dashboard continually. Our care managers see it and the clinician can see it. In the true collaborative care model, which is an evidence-based model, a psychiatrist sits in the background and interacts with the primary care provider either through the dashboard by making written recommendations about next best steps for treatment in the dashboard, seamlessly linked through the EMR or in the cloud, and can interact that way. Or what we've done is to go a step further, which is to say, we will make these psychiatrists available to you as a phone a friend in the need of an emergency, or in the form of having standing rounds with your clinic. So every week we can go over the 5 or 10 patients who are causing you the most angst. As an individual gets better over time, we can track that and see if care is working. If they don't, we also track that and can make recommendations to the point of being able to refer someone into the right behavioral health service. This is important, back to that issue of availability. If we flood behavioral health services with people who could be treated in other settings, we overwhelm the behavioral health system of care. If we can align the individual to get care in the right setting at the time that that setting is right for them, we alleviate some of the need for behavioral health services and let those be open for individuals who have the moderate and severe conditions. So using collaborative care with our partner NeuroFlow, we think we're betting on will really help increase availability of behavioral health providers to those individuals who really need them. Another strength of this is we can use those tools for measurement-based care and follow individuals over time. I want to give a quick example of why I know it works. So I signed up early on in the NeuroFlow app. I hooked up my Apple Watch to the NeuroFlow app, so all my physiologic data is feeding the app as well. And I was in a meeting with Chris Malero, and he was doing a presentation, and he put up a graph of someone's steps. And it turned out that they were my steps. And he had been tracking 10,000, 10,000, 10,000, 3,000, 2,000, and so he's like, this is the strength, because I can see something happened to Caroline these few days where she stopped walking. And I assured him I was swimming during that time. But the point is, and I want to bring this back to why it's so important. Physiologic data going into a tool where an individual is completing, say, depression or anxiety assessments. So if I see an individual who has stopped walking, who has stopped being active, and I see their scores rising, that is a key that something's going on, and I, as a clinician, should do an outreach. Now, let's add one more complexity to that. Let's pretend that the person is a diabetic. Now I have a condition where the outcome of an individual's blood sugars and perhaps their blood pressure are contingent on being active, on moving, on keeping, those steps going. So if I see 10,000, 10,000, 2,000, 3,000, I, as a clinician, should also start worried about, has the depression affected the outcome of their medical illness? And this tool, in the right hands and used the right way, lets me have insight into who needs to be reached and what outcomes we'll ultimately be able to expect from that. It's incredibly exciting.
It's remarkable to see how much thought and effort has been put into such a seamless experience, and ensuring that clear integration across the board is happening for the member experience. So super exciting. For the next question, maybe I'll start with Ken and then Dr. Carney. If you could tell us a little bit more about how companies like Magellan are really positioned to address the ongoing need for newer care models that really bring all these components together.
Yeah, I think the answer to that question builds on the answer and the amazing insight Caroline just shared, in that, when you think about what we have access to, and given the size of our business, our scale, the data we now have access to. It used to be people would give us their behavioral health data and they would say, do you think you can improve upon this? And now we say, we need to see all the data, because we can demonstrate, as Caroline just described, where oftentimes investing in behavioral health can provide, will generate a meaningful reduction in overall cost of care. And we all, in the end, are trying to bend the cost curve and looking at the whole person And so what Magellan can bring to these newer digital technologies is rich experience, data, and insight that can help power these tools in ways that will make them more effective. The predictive power of our insight, if the human body is the ultimate operating system, think about the code that we have access to. And so we can, through these partnerships and through the work we're doing in the Magellan Studio, which is an amazing laboratory, recently finished. We cut the ribbon a couple of weeks ago. We had actually our first meeting where we were able to bring more than 20 people, safely, into a facility. And it was extraordinary. One, just to be back together, but two, to see the energy that was part of a process we're going through. We called it our moment in time. But really, when you think about the confluence of all these things we've been dealing with, not just with the pandemic, but everything else happening in and around us. It's an important time for us to reflect on how we can lever our deep, rich experience, partner with new technologies, share what we know, and create a better outcome for everyone. And so the idea, as Caroline talked about, point solutions, we're actually embracing those, but in a way that will allow them to work seamlessly in a system that collaborates to the benefit, and again, not only of the member and their experience, but for the clinician who serves them. Let them work at the top of their license, give them access to the research. We can do for them what they, by virtue of maybe smaller scale, can't do for themselves, to look at these tools, to evaluate what works best, and to integrate it in a seamless experience for them. I like to say that the currency exchanged in the relationship we enjoy with clinicians is more than money. And so when you think about all these other things we can bring to that experience, it's exciting, and it's a great time to be at Magellan.
I can hop in on that also. I want to go back to the statement about point solutions in terms of an ecosystem, incredibly important, and that ability to change the way we think about behavioral health, traditionally in history, head up, right? We all know that is absolutely not the case. And so something else that we haven't talked as much about, I alluded to in the diabetes example, but it's the idea of really looking at integrated care. Whether those models of care involve truly physical or telehealth integrated settings where an individual can come in and get his or her primary care, OB care, gen care, whatever it is, with the same setting that the behavioral health care provider is sitting in. That truly integrated function where one roof, I can get the services I need in a seamless way, which prevents people from dropping out of care if they have to navigate another appointment on another day to maybe even another city, depending on where those services are available. So in moving toward integrated care, we have also made investments in the provider space to bring that together and use that as a basis for a model of care to disseminate across the country. Secondly, it's also looking at specific populations. One of those would be individuals in the Medicare setting who have a primary serious mental illness with multiple chronic medical conditions, and putting a group of tools, including high-touch clinical care interventions along with these supports to address those higher populations. I want to talk about a special population, looking again at that Magellan total ecosystem. We have, through our Pharmacy Benefit Administration program, multiple contracts with states who have ADAP programs. ADAP programs are those programs that have been around since the late 1980s with the death of Ryan White, a young individual with AIDS, and then growing from the 1990s to where they are today to provide services for low-income and uninsured individuals with HIV and AIDS. We were lucky enough to get some funding to kick off 4 pilots at the beginning mid-2020, even during the time of the pandemic, to provide a combination of services that included predictive modeling to find individuals who needed care, and care management services that provided inputs to providers and inputs to members to work on adherence of HIV/AIDS medications for this population, as well as the behavioral health conditions that this population had. So kind of the 1-2 punch, if you will. We're working on the whole person in those areas that are most needed. I am so excited to say that in the last month, even with under a year of data and experience in hand, 2 of those states have turned those pilots into contracted programs because they're so impressed with that ability to see the whole person and support across the ecosystem of care. I can go to bed at night knowing that with this program, we're saving lives. And, that's what this is all about for Ken and I and our teams at Magellan. We're driven by that kind of passion to make people's lives better, to treat mental illness, to improve medical conditions, and ultimately to save lives. I can't think of a higher calling than building these kinds of programs to make that happen.
Wonderful. Thanks so much, Dr. Carney. Really exciting to see how much Magellan is doing, impacting, as you said. Ken, do you have any final thoughts for us?
I would just end by, again, thanking you for, creating a platform for organizations like ours to get exposed to some of the amazing new technologies, to see how our peers are lining up as we are around the important transformation necessary, and the recognition of the impact that behavioral, mental health, and mental well-being has on total cost of care and the physical well-being of folks around the globe at a time that's really, I think, going to, as we look back, I think we'll see that this was an inflection point to reduce the stigma around the need to seek behavioral health, to open up a willingness to try new digital interventions to augment the important work that clinicians do on behalf, in partnership, not as an alternative to, because some cases, while it may be, in reality, bringing clinical expertise to guide folks to the right solutions will remain important, particularly with the growing challenges that are not soon going to be behind us. So again, I'm honored to have the opportunity to join Caroline in this great conversation with you, Salome, and thank you for giving Magellan the platform.
Thank you both so much. I mean, what an exciting time for behavioral health, but especially Magellan and all of the amazing work you're doing. Thank you so much for joining me.
Thank you.
Thank you, Salome.